everyone. Thanks for tuning in to this edition of For the Health of It. I'm Lou Beccaria, your host. So glad to have you with us once again. The topic that we're going to be covering today is that of neonatology. That's a big word, but it simply means the medical care of infants, especially those who are ill or are premature in their arrival into this world. These babies may have breathing disorders or infections, or maybe even birth defects of some kind. This subspecialty of medical care is a very important one, and here to inform us about it is Dr. Sudha Raman, a neonatologist with the Phoenixville Hospital Tower Health. So Dr. Raman, thank you for being with us.
Good morning, Lou. Thank you for having me.
Thanks for taking time out of your practice to inform our audience. So first, let's start off, tell us a little bit about your background.
So I came to this country about 25 years ago and then trained in pediatrics and neonatology, which is the special care of sick newborns in the hospital. I've been associated with Phoenixville Hospital now for 15 years, and I really enjoy working with our families in the community that come to deliver their babies at our hospital.
Oh, that's good. I can tell by the expression on your face that you're very energized by it all. So,
it makes for a fun day to work with babies all the time.
Sure.
Yes.
How did you come to choose neonatology as a subspecialty when there are so many others to choose from medical school?
Neonatology, when you're young, can be a daunting field, but what really got me excited was the fact that you can work with patients that really need your attention and care because they can't tell you themselves what's wrong with them or how they can be made to feel better. So that's a challenge in itself in terms of amassing the knowledge that you need to take care of these babies. But what really drew me to this field was the fact that you can work with mothers and families for a long time and help them be part of the care of their babies and help them understand what's going on and really educate and empower them to become excellent caregivers once the babies leave the hospital. You also get to work with a great team of people within the hospital, the nurses, the social workers, case managers, the pharmacist, everybody who needs to understand what it takes to take care of a little one.
Yeah, so, that's great. So actually you're not only a doctor, but you're also a teacher. In a sense, you're teaching the families how to take care of their babies.
We do, and we're lucky at Phoenixville Hospital that we also have a great relationship with the community in terms of the high school. We see high school students that we can help understand what this field is about. We also see a lot of students that are going into nursing, that want to become physician assistants. So there's an ability to educate and impact the younger generation that wants to get into healthcare and show them what it means.
That's got to be very rewarding to work with students and those coming behind you to teach them how the field is.
It is. And, they kind of remind me of myself and where I started when I was really wide-eyed and taking everything in. And then by the time they're finished with their rotation, you can see that they leave with a little bit of excitement that, yes, a lot of good can be done in this little environment.
That's great. Well, tell us, Doctor, a day in the life of you, the neonatologist. Okay, what is it like, and what's your role at the hospital?
So at Phoenixville Hospital, we try to make it where there's continuity of care. So as physicians, we're there for 24 hours. We stay in the hospital. We are not coming in from home for any emergencies. So we're right there because really my day is who is walking through the door that morning. Okay. It can be very varied. And that's part of what makes it interesting is because I can never predict what my day is going to be like. I really wish that all my babies do well, that they read the right chapters in the book and that they want to, go along with our care plan. But you'll be amazed, Lou, that even babies that are premature or that are really sick almost have a mind of their own where they're going to tell you that they're going to do this in their own time.
Really?
So over the years, I've learned to be very patient, but persistent with them to help them get better. So that's interesting in itself, is to help them, to coax them along the same path of care that you want them to do.
That's actually very fascinating to me.
Yeah.
It's like, how can a baby so young actually kind of the way you describe it, have a mind of their own.
So let me give you a small example. So if I'm weaning a baby off of the support that they need for breathing, I might consider them from all of the medical information that I have that morning that they're going to be able to wean on the support. But the baby will very quickly tell you that's too much work for me.
Oh.
And it's important to respect and understand that. And then also when you're coaxing them to eat, which, for you and me, that's an easy thing to do, right?
Yeah,
But for
too
a
easy.
baby, even a teaspoon or two may be more than they can handle. And they're going to very quickly tell you that. So it's really trying to be adaptable to every child and knowing that each child is unique in the time that they're going to do the steps in their care, and being able to be flexible with the plan so that you can really work with each baby as an individual to help them get better.
Yeah. Why is it that, how do these birth defects or the infections or breathing problems, whatever, occur? I mean, what causes those in, say, the woman's pregnancy?
So it's a lot of different factors. And some of it are important for us to understand because we can really impact some of these things that happen, and some others may be completely beyond our control. And by that I mean having good maternal nutrition early in pregnancy or even before we think that we want to be pregnant with a baby can prevent some of the defects that can occur. For example, having enough folate in your system can reduce a lot of the neural tube defects like spina bifida and other conditions that can happen in pregnancy. Also having good access to care and education about the care that you need during pregnancy is important because that can identify a lot of risk factors in mothers that can then impact babies. Mothers can be diagnosed to be gestational diabetics where their sugars are running higher than necessary, and that might be the first time that they know about that risk factor, or hypertension, which can show up for the first time in pregnancy. So regular access to care is very important in preventing to some extent, or at least controlling some of the risk factors that make babies sick or be born early. But honestly, Lou, for a lot of the conditions that happen, especially prematurity, we really don't have one good answer why that happens.
Yeah.
But we know that it's related to socioeconomic status, nutrition, access to care, and maternal education to the large extent.
Okay. We'll delve into that after our commercial break. We're going to have to take a break now, pay the bills.
Thank you.
We have the pleasure today of talking with Dr. Sudha Raman, neonatologist at the Phoenixville Hospital Tower Health. Folks, we're going to take a short break for a commercial and we'll be right back, so stay with us. Welcome back, everyone. For those of you who may be just tuning in, we have the pleasure today of talking with Dr. Sudha Raman, a neonatologist at the Phoenixville Hospital Tower Health. And we're talking about the whole field of neonatology and how Dr. Raman helps babies. So, when we left, Doctor, we were talking about, you mentioned about health disparity. So tell us a little bit about some of maybe the situations like that you encounter, and what resources, even outside the hospital, the community may have to help people with their babies who may be underserved.
This is a great question, Lou, which really speaks to the fact that we need to work on creating awareness of all the resources that exist in our Phoenixville community. We're really lucky here to have a variety of resources for our families in the area. The Phoenixville Healthcare Access is one that can provide free vision, dental screening, and even prescription benefits and help to families that may not have insurance or that may not have adequate insurance. And we also have the Phoenixville Clinic, which offers free medical care, and many other resoses that we can tap into.
Maternal and Child Health Consortium?
Yes.
Prenatal and postnatal
yes,
care?
That is very valuable because the more that women can have access to their care, especially when they're pregnant, that can address a lot of concerns around nutrition, like anemia. It can identify risk factors in the pregnancy that we may not otherwise know about until the baby is born. And it can really impact the health and nutrition of the baby on the inside through the entire pregnancy. Now, that means that when we see these babies delivered, especially at our hospital, we are able to be more knowledgeable about them, and we can often anticipate any difficulty that they might have, and that way, help them much sooner than if we were trying to find out what's wrong in the first place. So really, for our families to tap into a lot of the resources that they might find around the community is important, so that they can get the right care throughout their pregnancy for the population that I deal with, but this would be true of anyone, regardless of whether they were pregnant or not.
If medical tests indicate that while the woman is pregnant, that there is going to be a problem of some sort, when are you brought into the process? I mean, like at 6 months before the baby's born, right before the baby's born, or wait till after the baby's born? How does all that work?
So this is what we work very closely with our obstetric partners and colleagues at Phoenixville Hospital. I tell them that we're available whenever they need us. So sometimes we see mothers that are pregnant very early in pregnancy. And this might be, as you alluded to earlier, if they have a child that may be born with a congenital defect that might need specialized care. I'm fortunate to be part of a great health system, Nemours DuPont, which is based out of Wilmington, but we have a lot of partnerships in the area. So very quickly, once I see that mother, we can make a plan during the pregnancy should this child need specialized care or treatment or consultations with other specialists.
Yeah.
And that makes it easier for the mother to deliver at Phoenixville Hospital, but we have a plan of care for the baby. So our whole philosophy has been to keep care local as much as we can do that, because that is what our families want, is to be close to their babies.
Yeah.
But to have access to the specialized care that some child might need by having a plan of care in place.
Yeah.
And we're able to accomplish that quite easily. We also have telemedicine at Phoenixville Hospital. So even if we needed, a consultation in a hurry, we're able to access the right specialists to give us the right consultation service on these patients.
Yeah. Can you describe for our viewers what the NICU unit, and NICU stands for Neonatal Intensive Care Unit, right?
Correct.
Okay. So describe the NICU unit at the hospital.
So when you think NICU, often it's thought about as a very high-tech, kind of daunting space that's filled with monitors and ventilators and IV tubings and a lot of people that are very busy doing things around the unit. The NICU at Phoenixville Hospital is very unique. It's existed since 2003, and it's a very warm and welcoming environment for what must be a very stressful period in the lives of most families as parents, having a sick child in the NICU. We have 6 beds, and by that I mean we have adequate space for 6 patients at a time. We also have a quiet room in the back that we can use it as an isolation room if we need to protect babies that may have infection. But most often we use that space to treat our patients and babies that are going through withdrawal from opioid or other addictions that may exist.
Do you see much of that, doctor?
We do.
Regretfully.
Phoenixville, yes. But, the way that I see it is our place to help this epidemic that's happening across all communities in our country. And that stems from, again, forming a relationship with these parents and families and really educating them and empowering them and helping them to function by, A, getting the right care for themselves so that they do not relapse into their substance use or use medications that may really be harmful to the baby, but also in empowering them to become good parents for their children so that they learn all aspects of the care while we're treating the baby for their withdrawal in the NICU. So,
if a parent is on drugs, how is it that all of that gets transferred to the infant or the infant?
right. So when you're pregnant, you have to remember that mom and baby are essentially one unit. The placenta transfers nutrition, it transfers the good and the bad
I see.
from mom to the baby. So if mom is on opioids or other medications that they may sometimes truly need to manage pain or other medical conditions that they may have, but unfortunately a lot of what we see is not prescribed, it's unsubstantiated use, and regretfully, a lot is available out on the street that families may choose to, resort to in a hurry, especially if they're not in a good program where they can be monitored. So we see all situations where sometimes we know what the baby has been exposed to, but other times we're finding out by screening the baby's urine and stool to see what exists in their system.
I see.
And that helps us to use the right medications to manage them when they become very uncomfortable with their withdrawal. It often happens in the first week of life. So we watch these babies very closely for that first week. We're not able to discharge them in a couple of days because we know that they can have, serious consequences like even seizures or failure to eat and grow as they need to. But more importantly, we're trying to help them as they're forming these important brain connections in that first year of life,
Right.
which will impact their development down the road. So the whole treatment and philosophy around neonatal withdrawal is to make sure that these babies can eat, they can sleep, that they can be consoled and comforted. So we have a great program that is the Cuddler program at Phoenixville Hospital, where we have a lot of adult as well as young volunteers that come just to hold these babies and console them. So that's very important. It's equally important as the medications that I give to treat the withdrawal.
Wow. Fascinating, fascinating. Got a myriad of questions they ask you in the next segment, but thank you very much. We're going to take a quick break, folks, for a commercial. We've been talking with Dr. Sudha Raman, neonatologist at Phoenixville Area Hospital, and we'll be right back. Stay with us. Hi, welcome back to For the Health of It. I'm Lou Beccaria, your host. And for those of you who may be just tuning in, we have the distinct pleasure today of talking with Dr. Sudha Raman, a neonatologist at the Phoenixville Hospital Tower Health. And we're having a fascinating discussion about all the services at the hospital in the NICU unit. So, who is the team? What makes up the team, doctor, of the NICU unit to provide this great service for the mothers and fathers?
So Lou, you touched upon the key word that we use every day, and that is that we are a team. We cannot do this in the NICU alone as physicians. So our team comprises of our very experienced nurses who are taking care of that baby for an extended period of the time every day through their shift. We also have social workers, we have case managers, we have our administrative staff that can help parents, even if it means just, having a quick warm meal as they spend time in the hospital. And we certainly, draw upon our specialists as we need them. So the specialists most commonly tapped into for their opinion and resources in a NICU are the cardiologists, the neurologists, and sometimes if we have a baby and a family with a difficult situation of a complex congenital defect, we also draw upon the support of our palliative care staff, where we can offer comfort and care for these patients as they go through what must be a really difficult time.
Yeah, wow. So how does you as a doctor with the NICU unit work in conjunction with the hospital's Women's Health Pavilion?
So we are fortunate to live on the second floor of the hospital. We are a large closed unit, and so we work very closely with our obstetric colleagues. We work with maternal fetal medicine doctors who are specialized obstetricians that take care of high-risk pregnancy mothers. And we really have, support from radiology for all the studies that we may need. It can all be accomplished within the realm of the space that we deliver our care. So our families, and especially our babies, don't have to travel between different parts of the hospital. We do a lot of monitoring of mothers on the unit when we need to monitor their pregnancy closely, especially as they come closer to delivery. So we're able to accomplish all of that on our unit. And so as a communicative and unified care team, I get to hear about anyone that may have a potential problem well before they're due to deliver.
Okay.
And so that really helps that closed loop communication that we want to achieve when we're trying to deliver care to moms and babies that we consider to be one unit.
Sure. I guess it's a case-by-case situation for how long a baby stays in the NICU unit. Can you tell us a little bit about that?
Sure. So it really depends on what care they need and what condition they come in with. So it may be something as benign as, a mother being a diabetic and the baby being born and then having some transient problems maintaining their glucose levels. So that might just be a NICU stay of about a day. Other times we have babies that are jaundiced and need phototherapy, and that may be a couple of days. Similarly, if we're concerned about infection, but the baby continues to do well, then we may start antibiotics and just do that for 2 days. But most often, if we have premature infants, then we're looking at a stay of at least a few weeks. So I tell our families often to look at what their due date was, and then depending on how much earlier than that the baby is born, that's a good target
For how
to
long
think
the baby will have to
about.
stay.
But most often, babies are much smarter than we think, so they often get out of the hospital sooner than that due date. But that's a good initial idea to have in our heads as to how long it might take, because growing as a baby on the inside or the outside is a maturation process. And so to master the skills that you need to go home, which is kind of staying warm on your own, eating everything, breathing without forgetting to breathe, and really not having anything that interferes with your ability for your kidneys or your liver or your digestion to work. That all comes together around that 37 to 39 weeks. So most babies know that the hospital is not the greatest of places, so they're ready to bust out of there.
I like the way you paint the picture, doctor, of how smart the babies are.
They
both
are.
inside the womb and outside
Yeah.
the womb after they're
Yeah.
born. So I think that's fascinating. I never thought
We
about
do.
it like
That's
that.
really been my learning over the years, is that we need to give them a lot more credit than we do. They do. They have a mind of their own, but they're also smart enough to know when they can do things, and they really want to. They want to do it when they're ready.
Yeah. So let's turn to advice. What advice would you give to mothers and the fathers during the whole pregnancy period, and then afterwards, after they've had a baby delivered and the baby's in the NICU unit, in terms of advice, in terms of health prevention of problems, maybe all kinds of preventive kinds of things?
So to all our families, I would say that pregnancy is an exciting time. A lot of the times, families plan for it, and then sometimes it is a surprise. We understand that. But to think about, their health, their nutrition, getting regular access to care with a doctor, which can be a family doctor or an obstetrician who can guide you through the pregnancy, identify any situations that could be helped prior to the baby being born, and to deliver at a facility where you would have the gamut of services like Phoenixville Hospital, which has a NICU if you should need it. If the baby is in the NICU, I would really have a conversation every day with your doctor. Learn the care plan for your baby and try to understand it. Ask as many questions as you need, because there's never too many questions that you can ask about your baby, and really understand what that child is going through in terms of needing the support and help they need, and working with your child, whether it's providing breast milk that we consider very beneficial at this time when a baby is sick, and learning the routine care of your baby before you go home. At Phoenixville Hospital, we have our parents spend a night with their baby before they go home. We call it rooming in, because a lot of our NICU families miss out on that experience because their baby has been in the NICU after birth. So this is their time to stay in a room on our women's pavilion, but they're doing everything for that child. Yeah. And we're just across the corridor if they need us. And our families really appreciate that, because that's when it all comes together and feels real, when you're taking care of your baby by yourself for an extended period of time. So by the time you go home, I want to reassure you that you will be very well equipped to take care of your child.
Wow. Yeah. Well, that's a great way to end. We're out of time. I regret that, but it's a very positive and upbeat way to end the show. So thank you very much, Dr.
Thank you, Lou. Thank you for having me.
Really appreciate it very much.
Thank you so much.
And you've been a great guest. Thanks for all the information.
Thank you.
Well, folks, that's about all the time we have for the show today. We hope that you've enjoyed it and have learned a bit more about neonatal care of newborn babies. I want to thank the For the Health of It sponsors who put on the show for us, the Phoenixville Hospital, Tower Health, and the Phoenixville Community Health Foundation, partners in helping you become more informed healthcare consumers each day. My thanks also to the technical team of Phoenixville area high school students who helped produce today's show, as well as Art Carucci of the TV production faculty who directed today's show. Until we meet again, I'm Lou Beccaria. It's been a pleasure to be your host once more, and have a good day. And remember, folks, if you're healthy, you're wealthy. We'll see you next time.